Hello, my name is Dexter Williams. I'm a registered nurse, and today we're going to be discussing asthma education. What is asthma? Asthma is a chronic disease that affects your airways. Your airways are tubes that carry air in and out of your lungs. If you have asthma, the inside walls of your airways become sore and swollen. That makes them very sensitive, and they may react strongly to things that you're allergic to or find irritating. When your airways react, they get narrow and your lungs get less air. The allergic reaction that occurs is thought to be mediated by the individual's tendency to form abnormally large amounts of IgE antibodies, which cause allergic reactions with specific antigens, causing histamine release in the bronchial tree. The observed result is caused by three things: localized bronchial edema, secretion of mucus in the bronchial lumen, and spasms of the bronchial smooth muscle. These illustrations compare a normal airway on the left to an asthmatic one in the middle and an asthmatic airway during an asthma attack. That's shown on the right. Since the tracheobronchial tree is narrower on expiration than inspiration to begin with, this added airway resistance manifests itself as increased expiratory effort. Thus, an asthmatic can breathe in easily but has trouble breathing out. This is called dyspnea or air hunger and is characterized on a pulmonary function test as increased functional residual capacity and residual volume. After many years, the chest cage becomes permanently enlarged, producing a barrel chest. Although you may not be able to control the fact that you have asthma, you can take actions to prevent episodes of asthma attacks. For instance, create a plan. Work with your healthcare provider to create an asthma action plan. This plan should include a list of your asthma triggers and how to avoid them, a list of symptoms that you experience during the asthma attack, information about when to take medication and how much medication to take, information to help you understand your peak flow measurements, daily actions that you can take to control asthma. The second one is monitor your asthma. To monitor your asthma, use your peak flow meter every morning and every evening for 2 to 3 weeks. Record the results in a journal. A drop in your peak flow numbers on one or more days may mean that you are starting to have an asthma attack, even if you are not having symptoms. When you have asthma symptoms, write them down in a journal. Then, avoid asthma triggers. Work with your healthcare provider to find out what your asthma triggers are. This can be done by being tested for allergies, keeping a journal that notes when asthma attacks occur and what may be contributing to them, asking your healthcare provider whether other medical conditions make your asthma worse, and then acting quickly. If an asthma attack happens, acting quickly can decrease how severe it is and how long it lasts. Take these actions. Pay attention to your symptoms. If you are coughing, wheezing, or having difficulty breathing, do not wait to see if your symptoms go away on their own. Follow your asthma action plan. Next, we will discuss treatment and medications. One class of medications are called anticholinergics. An example of this would be Atrovent. This is a quick relief medication. Atrovent opens the airway by blocking reflexes through nerves that control the smooth muscle around the airways. It is a slower acting than the short acting beta antagonists and can take 15 to 20 minutes to show a significant effect. Then there's short-acting beta antagonists. Short-acting beta antagonists work quickly to relieve asthma and other lung disease symptoms. Beta antagonists relax the smooth muscles around the airways. And to note, if you use these medications for shortness of breath more than twice a week, talk with your doctor. If you use more than 1 meter dose inhaler a month, also talk with your doctor or healthcare professional. This is a sign that your lung disease is not under good control, and your long-term control medications needs to be adjusted. Oral steroids. This includes pills and syrups. Steroid pills and syrups are very effective at reducing swelling and mucus production in the airways. They also help other quick relief medications work better. They are often necessary for treating more severe episodes of lung disease. Inhaled steroids. An inhaled steroid is typically prescribed as a long-term control medicine. This means that it is used every day to maintain control of your lung disease and prevent symptoms. An inhaled steroid prevents and reduces swelling inside the airways, making them less sensitive. It may also decrease mucus production. An inhaled steroid will not provide quick relief for asthma symptoms. In addition, inhaled steroids may help reduce symptoms associated with other chronic lung conditions. Inhaled steroids are the most effective long-term control medicine currently available for asthma. They improve asthma symptoms and lung function. They also have been shown to decrease the need for oral steroids and hospitalization. So how do we know if what we're doing is working? Controlled asthma is defined by daytime symptoms less than 2 per week, no limitations of daily activities, no nocturnal symptoms, meaning symptoms at night, no need for reliever medications less than 2 weeks, or normal or near normal lung function, and no exacerbations. You are considered to have partially controlled asthma if daytime symptoms are greater than 2 times per week, any limitations of daily activity or any nocturnal symptoms, the need for reliever medications less than 2 times per week, or any exacerbations. Asthma is one of our nation's most common chronic health conditions. Many substances can aggravate allergies or increase the severity of asthma symptoms in individuals who are sensitive to these allergens or irritants. For instance, there are cigarette smoke, bugs like cockroaches, dust mites, pets and animals, and pollen. It is recommended that individuals who have asthma stay away from these triggers or irritants. Thank you very much for your attention. This concludes our information on asthma. If you have any questions, please contact your local health provider. Thank you very much.